And hi, everyone. My name is Edwin Waichakon, and welcome. I'm so glad you could join us here today for the first session in Infoway's five-part series, Connected Care in Action. Over the next few months, we're going to be diving into real innovations happening across Canada, but today we're starting with the daily grind that most clinicians know all too well, specifically documentation burden. Notes, forms, clicking, typing, backspacing. It's become this endless cycle of notes that pulls people away from patients and pushes folks closer to burnout. And it's an issue that we know is system-wide and affects everyone. But here's the good news. AI scribes are already proving they can help. BC pilot showed 3.4 minutes saved per appointment with 97% physician satisfaction, while an Ontario pilot reported 70 to 90% reductions in paperwork time. So at this point, we're not asking if the technology works. The real question is, how do we bring this to scale across the country without breaking what's already working? And more importantly, doesn't just pile on top of another tool. How do we set the stage to do AI right in a way that actually supports the healthcare system? So just as a reminder, feel free to submit questions using the Q&A feature. We'll address as many as possible during our discussion time at the end, close to the end of the call. So with that said, I'm lucky to be joined by three folks who are really deep in this space. And I will say that while we're focusing on physicians today, I just want to say this up front. Admin burden hits everyone on the care team. Nurse practitioners, specialists, admin staff, and a lot more are all navigating these same challenges. So with respect for those shared experiences, we're going to begin by hearing from our physician colleagues about how these challenges are showing up in their practice. So first up, a dear friend of mine, Dr. Rashad Bayat. Rashad is a family physician practicing in an EMR-enabled clinic in the GTA and one of Infoway's very own senior clinical leaders. He brings a valuable dual perspective, including frontline clinical care and national level digital health leadership with a strong focus on making care more connected and information more accessible. Next is Dr. Lynn McCallum. Lynn is a family physician based in Edmonton. She spent years practicing in California, where digital tools like e-prescribing were already standard. Moving back to Alberta and encountering paper-based systems gave her a renewed passion for advocating for practical and effective digital health solutions. Real quick, Lynn, I gotta say, sorry about the Oilers. I think a lot of us here were cheering them on, but maybe next year. And finally, Dr. Jaren Easterbrook. Jaren is a family physician in Sydney, BC. Before entering medicine, he spent 15 years in tech, including roles at Apple and Canada Health Infoway. After shadowing an ICU physician, he was inspired to change careers and completed medical school, is now a family physician, and co-chairs the Family Practice Services Committee Information Sharing Task Group, which is a partnership between the government of BC and Doctors of BC, focus on developing frameworks for sharing health information between different healthcare providers and systems. Okay, we got all of that out of the way. Now let's dive deep into it and get started with the elephant in the room, documentation. We know it's eating up a ridiculous amount of clinician time. And in Canada, clinicians spend anywhere from 10 to 19 hours a week on documentation. That's 18.5 million hours across the country just doing paperwork. And this is the wild part. They actually have a name for it, pajama time. Um, I've heard of game time. I've heard of crunch time, but I haven't heard of pajama time. This US study describes it as the time clinicians are at home, off the clock, still catching up on notes they didn't have time to finish during their shift. So, Lynn, as a clinician now using AI Scribe, Can you describe what your documentation workload was like before adopting this tool? And how do you think AI scribes changed your daily workflow, productivity, and your ability to stay fully present with patients?
Good morning and good afternoon, and I really appreciate being here. And yes, I do want to talk about what life was like before using my AI scribe. I've been using one for about a year, and I can tell you that I did some research on them and tried one on a free trial, and it was going to last, a few days, a couple weeks, whatever it was. After the first 2 days, I signed up for a year because it made such a huge difference in my overall quality of life in working in general. Before I was using an AI scribe, I would spend between 1 and 2 hours every night doing documentation because it is important. We can't shirk that duty. We have to keep up with our notes. We have to make the notes complete. And we can't do it in front of the patient most of the time because we're trying to pay attention to that patient. But you're still distracted by that computer. So you do one of two things. You either pay attention to the patient or your eyes are focused on that computer making notes because you don't want to forget something important. So what happens is you make a few notes, you're still distracted, the patient doesn't get your full attention, and then you spend hours at home finishing up work that should have been done at the office. And I know my colleagues out there, can relate to this. We all have been in the same boat. We have to keep good notes for good patient care, but it eats into our family time. So I'm happy to say that since I started my AI scribe, it has made a huge difference. I get my notes done usually in front of the patient, maybe a few minutes after they leave. I go home on time every night. It's made a huge difference, and I can't go back. There's no way. I'm never going back to the old way.
Well, it's great to see how helpful it's been, not only in your practice, but giving you back more time with your family. Uh, Rashad, from your perspective as a practicing clinician and someone working on health systems at a national level, how does this admin burden connect to broader system sustainability?
It's a great question, Edwin, and thanks again to yourselves and Longwoods and Infoway for the opportunity to be here. So we know we're facing multiple crises in healthcare in Canada at the moment following the pandemic, and it's particularly acute in primary care, especially in family medicine. Crises related to clinician burnout, an interoperability gap, and resulting patient safety challenges. And clinicians, for the most part, we're dealing with tools that do not allow us to easily and efficiently participate in the healthcare system. So 18.5 million hours per year, it's hard to fathom, but when you break that down into CMA Infoway survey data, it indicates about 107 minutes per day of time spent on an EMR after workday. That's a huge amount. Those are hours per day, days per month that could be better allocated, give time back to clinicians and to patients. And there's a direct connection between this additional digital administrative burden and clinician burnout levels. 44% of physicians reporting feeling burned out to some extent in the same survey, and that's backed up by studies by provincial and territorial medical associations as well. And morale is then absolutely affected, which is why we are seeing more family physicians leaving comprehensive family practice. And it has a knock-on effect on recruitment of young family medicine trainees. We need to make it easy and attractive for clinicians to participate in a digitally interoperable environment. And it's not just a technology problem. That's only one piece of the puzzle. But if you can at least make it so that the technology doctors and nurses are using is not a barrier, you will be ahead of the game. Make technology work efficiently for clinicians, like Lynn has just described. So if we can do that, we can increase the capacity of our current clinicians to not burn out and gradually increase their ability to focus on higher value clinical care, and we can attract more people to clinical professions. And in the case of AI scribes, as Lynn and a number of many other physician colleagues have noted, we might actually add joy to the practice of medicine.
Thanks, Rashad, and thank you, Lynn. It really sounds like it's clear that this issue, this documentation burden, is beyond frustrating, and not only for the clinician, but also for the system at large. But fortunately, it sounds like, like you guys have mentioned, AI scribes can help. But as we consider this technology, this new technology, Jaren, we know that this clinical documentation isn't just about dictation. There's nuance, emotion, high stakes. What do you think makes medical note-taking so uniquely complex, especially when we think about AI handling it?
Well, thank you for setting me up to talk about what sounds like a Mission Impossible movie. High stakes. I would also like to thank Infoway, Longwoods, and the 200 people I can't see on my screen for inviting me here today to share my experiences. I've used AI Scribe for the last year in family practice, and I think depending on the situation, how the patient holds themselves, their facial expressions, how quickly they speak, all of those are important aspects of an encounter that may need to be captured in order to add context to the actual words that they say. And that's to say nothing of the physical exam. Quite often it's what you don't find that's incredibly important and those pertinent negatives. When working with an AI scribe, certainly I've had to think carefully about what I'm going to say in front of a patient, about what I'm not discovering, so that I don't freak them out. Um, and I think effective documentation um, involves many simultaneous components, right? You're listening, you're looking, you're feeling, you're strategizing on the fly how you want to word things based on your knowledge of the patient in front of you when you talk to them. You're reviewing previous results, and you're also thinking ahead to what are the potential diagnoses that I'm considering, and so what are the questions that I need to ask or the exam that I need to do. The last thing I want to have to do is call the patient back in order to complete a referral or a lab requisition. At a minimum, I see an AI scribe as helping me focus more on the patient and my conversation interaction with the patient, freeing me from the keyboard. And I thought I was a touch typer until I compared what I was coming up with versus what the AI scribe came up with, which was a bit humbling when I realized how many things the patient said that I actually missed. But also from a medical legal perspective, the number of things that we talked about that I didn't document because I was focused on talking. And so I would say that my notes are better now. They've certainly improved. So yeah, that's a taste, I think.
Yeah, thanks for that. It really goes to show that we have a complicated problem on our hand and a promising tool. But before we jump into it in a little bit more detail, let's take a look and see what we can learn from others who've tried this, because we know this isn't just a Canadian headache. People around the world are tackling this, and the results so far are pretty exciting. At Stanford, clinicians reported significant reductions in burnout and task load, saving 11 to 20 minutes a day. And the NHS and the UK saw reduced admin time and more meaningful face-to-face interaction with patients, something I think all of you have mentioned and experienced. So these early adopters obviously see a benefit, and they've flagged important factors for success, seamless workflow integration, proper training and onboarding, ongoing clinical oversight, especially for nuanced medical documentation. Lynn, when you hear about these factors that dictate success, what resonates most with your experience and adopting new technologies?
Well, I think one of the things that can be daunting is just the number of different scribes that are out there. It's hard to choose. Um, it is good that there are a few that have been more vetted to be able to work in the Canadian environment, and we know that they are already in use and very successful. Um, you have to have a champion to be able to bring the staff along and say, hey, look, this isn't going to impose too much on our practice. In fact, it will give us time rather than take time away. There's always a few minutes to a few days of kind of getting settled in, but it's so worth it. And people see the value immediately when they start being able to pay attention to the patient and less about trying to get the documentation. So in that regard, being the champion for the office has been super easy because it's just like, see, look here, this is how it works, and it just works. Um, but yeah, I mean, having something that actually does just work out of the box is really important. If there's too much of a learning curve, if there's too much of hands-on trying to work it out, it does become a detriment, but of the ones that I've seen, they've worked that out. And I will say that there have been many trials of different ones around Canada. Dr. Easterbrook has some information on ones that were done in BC. There was a trial of ER physicians that I found really impressive, because I'm thinking, if you can use an AI scribe in the ER with all that chaos going on, you know, it says maybe my little quiet office isn't going to be so hard after all.
Yeah, I totally hear where you're coming from. It sounds like, it's not only just having a good technology, it's having those change management pieces, having that champion that can advocate for these changes, this implementation. Jaren, I know you've been involved in helping physicians navigate digital and virtual transitions in the past. What lessons from those experiences do you think can be applied to the adoption of AI Scribe so that it genuinely saves time rather than adding more work to a clinician's plate?
And that is the key question, isn't it? I think, in looking at any technological change, or any change for that matter, I see sort of four key components. So compelling, concise value proposition. Oh no, it's going to stick up my thumb. The recognition that participants are at different states of readiness, and need different types of support. Understanding that in family medicine, especially, or at least that I can speak to, support needs to take place at the elbow, not on a screen or a stage. And then lastly, that evaluation is critical to building that ongoing trust. So, digging into those from the perspective of AI Scribe, what I'd say is, without a clear vision of where we're going, people won't change. For AI, this means, sure, studies, but more importantly, it means peers who can speak to the benefits and the cons. And most importantly, as Lynn mentioned, people need to really understand the impact on their workflow. This will change the way that you work. And even if that's minimal in the grand scheme of things, it's still really important to know. Otherwise, we have mismet expectations. While some people have used AI Scribe for a year or more, others haven't tried it yet. In a recent survey of family physicians in Victoria from a month or two ago, 19% currently use an AI scribe, 22% are ready to explore options, 31% want more information before exploring options, and 22% categorically refused, saying, I'm not interested and I don't want to try it. Each of those groups, well, maybe not the last, need different supports to move them along that adoption curve, in the time that they're willing to move. Because we're so busy seeing patients, it is incredibly hard to carve off time to explore solutions, try them out, think of what you need to do from a workflow modification perspective, implement, and then evaluate. And so having a coach who can work alongside you at your elbow, understanding your particular needs, identify opportunities, the low-hanging fruit, and provide the resources that will help you move forward sort of incrementally, where at each step there is additional value that you're realizing, I think is key to solution. The other piece I'd suggest is from a jurisdictional perspective. In BC, we have more than 7,000 family physicians. And so aside from the insane waste of duplicate effort it would be, there's no way that we all have time to develop consent forms, create privacy impact assessments, identify those necessary workflow changes. And so I think those foundational pieces need to be created by central, trusted organizations, and can be generic enough that they apply to all. And then lastly, I'd say, from an evaluation perspective, according to the Canadian Medical Association Journal, physicians in Canada spend an average of 43 to 48 hours a week working. In the Ontario study, 79% of participants said they were able to spend more time on patient care as a result of using the AI scribe. I think this pilot that Infoway is doing is a fantastic opportunity for us to look at what physicians do with the time, savings that we hope, the pajama time, that we hope to realize. What is the impact on patient care? Those answers will help us build trust amongst physicians, nurse practitioners, allied health, who all are using AI Scribe, but also with patients, because ultimately, AI is a scary thing out there. We've all seen Terminator. And so, if we want it to become a permanent fixture, patients need to trust it and trust us.
100%. Like I think I couldn't agree with you more. Those four key components is they're critical to clinic implementation, but we also, on top of that, need to make sure that we're meeting different clinicians where they're at, right? That's the only way we're going to be able to move the dial and get clinicians back to doing what they care most about, which is caring for their patients. Rashad, we know from a both a personal and system level perspective, um, you know, we know you have that experience. What do you think stands out as the most important lesson from these global experiences?
Yeah, thanks, Edwin. And Jaron's made some really, really important points there already. I do want to start by saying, when you consider something like a new tool like AI scribes, it's never been about the technology, even though we're talking about a specific technology right now. There's a famous quote from William Gibson, sci-fi author. The future is here, it's just not evenly distributed. It's about finding the right application for the technology in a way that solves or addresses an urgent clinical or patient-focused problem, which is what AI scribes are doing and why they've become so widely adopted so quickly. It's about supporting clinicians to adopt a technology that makes sense within our current workflows or that change our workflows for the better. So, thus, we've seen the successes on balance of AI scribes in multiple practice settings in varied healthcare system models around the world, as you have noted, including the UK's NHS, including the United States in California through the Stanford studies. They solve AI scribes solve a very specific clinical problem, and they solve it well without a huge disruption to existing workflow. As Lynn noted, they mostly work out of the box. All three of us physicians on the call today have gone through an EMR adoption curve at some point, and we can probably all attest, at least I can for sure, that adopting an AI scribe is a lot less challenging than adopting an EMR system from scratch or a hospital information system from scratch in general. However, as Jaron has noted, you definitely need supports along the way. And, we've seen this in the past with EMR adoption in Canada, for example. We've seen the importance of change catalysts, massive ones, in the form of change support programs, incentives, policy changes that have taken many forms and combinations. Clinician peer networks were the unheralded secret sauce in that period. And again, echoing Jaron's comments, peer supports, in particular, stories from peers, are very important. So with a new tool like AI Scribes, these supports are first needed for adoption and then sustainability, keeping it going. And the ease of use is critical. And while AI Scribes are not a silver bullet or a magic potion, AI Scribes and related generative AI powered tools have really great potential, as these studies have shown. To sustain that positive change, though, you need ongoing supports for adopting the solution and adapting to that new scenario that you then have.
Thanks, Rashad. It really goes to show that, I think all three of you are saying similar things, right? Like this technology works. It's been proven to be successful, but what makes it successful isn't necessarily just the technology itself. It's the right supports at the right time for the right people to make sure it works. So now zooming back in, let's talk about what it actually takes to try to pull this off across Canada's patchwork of systems. If we're serious about building a connected health system across Canada, then I think we can all agree that AI scribes have to fit into that, at the very least play a role. It's not just another shiny tool they've got to work with. It needs to be something that works with our existing data ecosystem and not against it. They generate new clinical data, but rely on existing systems to function. So we need to ensure that that data that it produces is usable, shareable, and secure. So, that really means an adherence to national standards like FHIR, alignment with provincial EMR systems, and a design that supports the realities of clinical practice. Rashad, I know that Canada has been investing heavily in interoperability and connected health data. How do you think AI scribes fit into that broader strategy? And, what needs to be true from a data perspective to ensure that these tools contribute to our shared digital health goals rather than complicate them?
Yeah, Edwin, great question. And in answering the question, I'll try to, put a bit of background and frame it a little bit. So I'll come back to the idea that AI scribes are not a silver bullet. They're a new, very useful tool that has a very useful focused application. And just remember and remind the audience that our recent CMA Infoway physician survey demonstrated that physicians and other clinicians are really struggling to operate in a digitally disconnected environment at the moment. Our recent Digital Health Interoperability Task Force, for example, a collaboration with the CMA, the CFPC, and the Royal College, identified barriers, many barriers for physicians and nurses to participating in a digitally connected environment, technological issues, so systems that don't talk to each other, that are heavily fact-based, policy and legislative issues, issues of clinician burnout, which we've talked about already, linked to the download of administrative burden and cost. But the task force made concrete recommendations, and one included addressing the barriers through co-design, for example. Another recommendation was leveraging new and emerging technologies like AI to better support clinician participation in a digitally enabled environment and make it so that physicians do not have to be data entry clerks. Make it easy for us to do the right thing. Automate mundane tasks that clinicians were never intended to do. And this is where we have the idea of an AI scribe maturity model, where that comes into play. Thinking ahead, we can move gradually from basic AI scribes to EMR integrated scribes to AI scribes that can support enhanced data capture and improve primary care data quality and support standards-based interoperable data, moving towards AI, the use of AI agents eventually. Scribes and AI, like related generative AI tools, will be able to package data into national standard formats, like the patient summary, like CA Core Plus, to enable transmission of information, health information, in a secure, more seamless way, leveraging modern FHIR-based transmission. And the same tools should be able to support emerging primary care EMR standards like Halo, again, enabling a more standardized and timely exchange of information between disconnected systems. So clinicians and patients need to have a degree of trust in these tools. Thus, programs like Infoway's AI Scribe program and equivalent provincial and territorial initiatives can help to ensure a certain baseline level of compliance with cybersecurity, privacy, and interoperability standards.
Thanks, Rashad. So it sounds like, addressing documentation burden means building solutions and strategies through co-design with clinicians using those standards and implementations. And really, ultimately, it's about how can we leverage what works and what's going to work to ensure that we're avoiding clinicians having to be data entry clerks, right? Jaren, I know you're working hands-on with information sharing across health authorities in BC. From your perspective, what do you think are the critical system level and clinical factors that could either support or hinder the practical use of AI scribes on the front lines?
Yeah, so I think so great question, and I think Rashad sort of has done a very nice introduction to this piece. I'll go back to the foundational pieces. So AI scribes are now a commodity, and there's so many options. There isn't enough time for me to take away from patient care to look at all the different options, evaluate them on their own. And so I think Infoway has done a fantastic job by setting out, here are a clear list of requirements. We've identified vendors that meet those requirements. Not that those are all of them, you're free to evaluate your own, but hey, these ones do. And so I think for most physicians, or for many physicians, having such a list will give them a clear place to start. Then you get into the word of mouth, what are peers using, et cetera, and what supports are available to help you customize workflows, et cetera. I think the next piece is access to the tools. So for independent physicians such as myself in private practice, it's really easy, right? I make a decision, I sign up with a vendor, I take advantage of the funding from Infoway, and hopefully I make the list before all the seats are gone. But for those who are working perhaps in a health authority run clinic, there can be challenges challenges because the health authority is quite rightly pursuing an enterprise solution for AI scribe. And so the reviews of independent vendors may be down the road. And certainly that's what we're seeing in BC. I'm perhaps optimistically hopeful that we can convince BC's 5 health authorities to work together and jointly do one review. I'm not quite sure how politically realistic that is, but having each health authority go through a PF for the same tool seems like a redundant process. And so I think the workflow piece is critical. So understanding the workflow, and I can't help but remember a meeting I was in previously while at Infoway, where it was with a bunch of EMR vendors, and they thanked everyone at the end of the meeting. It was great to meet our users and understand their workflow. And it just was like, really? You've not talked to your work users and understood their workflow? Admittedly, this was over a couple of decades ago, I guess. So I'm glad to see that things have changed and that the requirements that Infoway set up outline clinical usability as one of them. And then lastly, I think patients. So most of my patients are highly, in fact, I've only had one say no, supportive of me using AI if it makes my life easier. And that's usually what they say. Oh, does this make your life easier? Absolutely. Fine. Of course, being able to say it has no access to your chart, it knows nothing about you, I read what it generates before I copy it into your chart, makes it really easy because it's basically just taking notes, and it's acting sort of like a med student in the corner. That goes a long way to making people feel comfortable. While I look forward to the tools being able to complete forms or prompt me with potential diagnoses that I haven't considered based on the information in the patient's history, that will need a much more robust patient education to take place. And I'm not 100% sure that I can have that conversation because it will probably take, a fair bit with every patient. And so, any resources that vendors, Infoway, other jurisdictional bodies can help with, I think would be very much appreciated and would be considered, in my mind, a critical success factor.
That's amazing. It's great. It's great to hear, Jaren. Those comments and your support for the AI Scribe program, Infoways. For the folks who haven't heard yet, we recently launched a AI Scribe program across the country where we're going to be providing 10,000 fully funded licenses for primary care clinicians across the country, and it really serves to demonstrate as a signal from the federal level that admin burden is not just annoying, but it's a blocker to sustainable and effective care. And like you mentioned, we're not just committed to rolling it out. We're committed to understanding its impact. So this program is going to follow a robust evaluation framework, assessing outcomes before, during, and after implementation to measure its effect on time savings, administrative burden, workflow integration, clinician adoption, and overall scalability. Rashad, I know you've been instrumental in designing this program. Do you want to share more about it itself? What's been the guiding philosophy in ensuring this feels genuinely supportive to clinicians?
Thanks a lot, Edwin. First I should really say the program, as you've alluded to a little bit, it's been a huge lift in a short period of time, and I've been really fortunate to work with a very high-performing team, including our lead, Krista Belenko, Dr. Ed Brown, Simon Higgins, and many others, including our enablement team, privacy and security team, procurement team, performance evaluation team, and many others, including our executive sponsor, of course, Abby. So we wanted to make the national program really easy for clinicians to participate in, but also needed to balance provincial and territorial needs. We attempted to design the program with a clinician-first mindset based on feedback from frontline providers, including early feedback from our own clinician advisory committee and ongoing input from clinicians and non-clinicians through our external advisory committee. The program has used, as you mentioned, a very rigorous evaluation process, to establish a list of pre-qualified vendors, ensuring that baseline level of privacy, security, cybersecurity standards, and interoperability standards looking into the future through that maturity model. And this concept of EMR integrated products has been emphasized in that greater context of the AI Scribe maturity model that I was describing. The idea that we want to reduce clinician admin burden which also includes multiple logins, for example. Clinicians do have the choice to pick the tool that best fits their workflow within the context of their province and territory. In terms of change supports, there are vendor-specific tools that are provided for onboarding and training, and Infoway complements that with, and Jaren's alluded to this a little bit, tools that make it a little bit easier for clinicians to right out of the box, right from the get-go, have all those things there at the ready from a change perspective. So, for example, an AI scribe readiness checklist to see that everything in your clinic or your space is ready to go. A patient consent and staff education, patient consent and staff education resources. And I just should add that provincial and territorial organizations will have their own resources as well, many of which are very high quality and are very specific to the region with lots of nuances there. And all of this does tie into the broader connected care vision. AI-powered tools can support greater interoperability of standardized health information and can lead to less fragmentation of data within the system. And last but not least, I don't want to understate the importance of something that Jaren alluded to a little earlier, which is that importance of measuring what we're doing here. Through our performance evaluation team, we are conducting multiple robust studies to measure the impact of scribes on the clinician and patient experience. And I know there was a question in the Q&A on that. So this is happening. It's been quite carefully designed. It should help to inform policy and sustainability discussions in the future, which was another question or comment that was in the Q&A. And so we're hoping that this will be a very, again, robust data set that will help us have those insights and advise nationally, provincially, and territorially, and help us move forward on this.
Rashad, I think you really hit the nail on the head on like the important philosophy around the program, and really comes down to, clinician usability being a key principle of the program. I know within just the first week, we've already seen thousands of clinicians sign up for fully funded license. And if you want more information, please check out the Canada Health Infoway's website to learn more. Lynn, I know from what you're seeing on the ground, a program like Canada Health Infoway's AI Scribe is shaping the day-to-day reality for primary care clinicians. Do you think this kind of support could meaningfully reduce the documentation burden they face?
Yeah, great question. I think it speaks to how important this is to doctors as far as, you know, these solutions, although they're there, they may require some time to actually implement. They may need to be vetted, and the fact that Infoway has set up a list of vetted scribes already, so that we can just look on that list and choose something from a variety of scribe solutions that may integrate with our EMR already. We don't have to do that research ourselves. That really helps. But it all speaks to the admin burden that we're all dealing with on a day-to-day basis, right? I mean, we want to see patients. We don't want to be saddled with all of this documentation. And the more that the AI scribe can help us with that, the less burnout there is, and hopefully be able to retain the physicians that we have and maybe entice a few people to come into family practice. We didn't go to medical school to sit in front of a computer and fill out mindless forms. We went to medical school to help patients. And the more time that I spend with my face glued to the screen, typing away at a 16-page CRA disability form or something like that. Yeah, Jaren has never seen one of those, right? I mean, we all hate them when they come in. It's terrible. If we can get some help with that, that reduces the burnout, because that's time I can spend with patients, looking them in the eye, doing that actual visual survey and seeing that nuance of their body language and expression that is so important to us doing what we do best, right? I'm not a secretary by education. I'm a doctor, and I'm doing the more of that I can do will reduce, will improve the time that I have with the patients and reduce my burnout. And having it fully funded, wow, that is a big bonus. You know, when I first looked at an EMR back in California, I went with a free one because I couldn't afford to get the really big industry ones that were available. We just did not have the funds. I was a solo family doc, and if I wanted an EMR, it had to be something cheap, and that's what I went with. And it worked out for me. But the fact that we have something that's fully funded in Canada, wow, this is great. I can't see why anybody would say no to that.
Well, it's great to hear how much you support the program, and obviously, it seems like it's playing an important part in making that vetting process a little bit easier and getting clinicians back to focusing on the patient. You know, Jaren, I know that you've been closely involved in provincial work around data sharing in BC, and there's been real momentum in your province. Doctors of BC ran a pilot with over 7,000 appointments using AI scribes, and the Rural Coordination Center of BC funded rural physicians to try out these tools in their own practices. Even Northern Health is starting to integrate ambient AI tools in clinical settings. Are there, any local or regional initiatives you've seen or been a part of that align with this broader shift in documentation support?
Yeah, I mean, there are so many. Everyone is speaking about AI Scribe from our local divisions of family practice, which are sort of the community versions of medical staff associations in hospital, um, uh, to provincially at the Family Practice Services Committee, to health authorities, to the province, to Doctors of BC. And so part of our challenge has been getting everyone's attention focused on sort of one effort, so we're all moving in the same direction as opposed to a game of pickup sticks. And this speaks to that reduction of duplication of efforts, et cetera. And so I think the Infoway program has come at a great time because it is sort of that rallying point, even if as you were alluding, the seats are going to go pretty quick. That it is an opportunity for us to pull eyeballs onto resources that have been created by Doctors of BC, by FPSC, et cetera, and help people to ensure that they are successful in this endeavor. Obviously, I'm a believer. I drank the Kool-Aid. Though, Lynn, to your point, I really wish that the CRA would develop an AI to allow people to pre-screen whether their disability tax credit is actually going to fly before I spend hours and hours filling it in. Um, Anyway, I think, Edwin, you mentioned the Rural Coordination Center of BC. So they funded 800 licenses. Those were snapped up in, I think, a matter of 2 months. And I totally, understand why. Like in my day, doing both clinical practice and medical leadership, my day is often broken up by meetings, which means I frequently leave charts unfinished, don't tell, with only skeleton notes. And so during super busy periods, it would sometimes be days before I got to finish them. And, hopefully my bullet points were okay. But now that monkey off my back is gone because I know, as Lynn was saying in her opening, that within 5 minutes of my day ending, all of my charting is done, not my tasks, but my charting, which is a physical relief. I felt that in my shoulders when I first realized that. It was like, wow. Um, in fact, provincially, before learning about the Infoway program, FPSC was looking at funding licenses for family physicians across the province. But after really looking at it, we thought, our efforts are actually better spent on developing those resources to support people and to move people forward when it comes to adoption. And the vision is compelling. Like for $100 a month, give or take, I can save hours each week. And that seems like a pretty good deal from a work-life balance. In fact, I would say that AI Scribe might be the single biggest thing we can do that will make a difference in work-life balance for those who use it. Patient access and hopefully patient attachment, but really curious about that evaluation that gets done. And I think in BC, what we're looking at doing is actually pairing Infoway's evaluation with an analysis, looking at billing data with permission, of course, to see what is the actual impact on the number of patients seen, the number of patients attached to panels. At a minimum, maybe we should present the ministry with a bill saying, hey, look at all this money we saved in charting time. Because potentially if we trust the averages, that could be a savings of up to 100 million a year. Don't quote me on that maybe until we get the final numbers, but I think it's a big deal, I guess is my point. So I think, Edwin, this is incredibly exciting and everyone's interested in it. And so I'm really happy to see things move forward.
And I'm glad to hear that. I'm glad to hear that that monkey is off your back. And I imagine it's off Lynn and Rashad's back, and hopefully off the back of the clinicians who signed up for our program as well. So I want to shift gears a little bit and kind of shift the question to the entire panel, to all of you. What do you see as the real value of having this kind of coordinated national approach? Pre-vetted vendors, built-in supports, and zero-cost access for clinicians. Maybe we'll start with Jaron.
Sure, I can kick it off just with a simple statement. I mean, I think, I'm a firm believer in not duplicating effort. And so I think this is a perfect example of the type of foundational infrastructure effort that can be done at a very large level, because this is something that we all do, and it doesn't matter where in the country you are, we have to chart. And that brings economies of scale, and coordination of effort, and reduction of duplication. So I'm really hopeful that this is the first of future efforts along those lines.
Great, thanks, Jaron. Rashad?
Yeah, great comments from Jaron on that one. I mean, I'll come back to the idea of the necessity of change catalysts in our very unique healthcare system. Canada's healthcare system is actually many distinct provincial, territorial, and Indigenous systems. And this program harkens back to programs from the past, in which we have a unique change catalyst, an incentive designed to support the adoption of a unique category of a digital tool, AI scribes, that can benefit both clinicians and patients. And the rigorous process that we've set up here adds to a level of trust for clinicians and for patients, who otherwise might have been a little bit reluctant or anxious about taking the leap to test out the new technology. So I think there's a number of advantages and benefits here, and there are a lot of studies work. Infoway ourselves, we did a paper not too long ago on the role in certain types of healthcare settings that big change initiatives can play.
Amazing. That's great. And then we'll pass it over to Lynn, and then we'll get started with our question and answers.
Yeah, and I just want to reiterate that, from a doctor that started practice using pen and paper to take notes. And then we start with like the dictation programs that came out. And then you move to an EMR that was supposed to make everything better. And it actually just became slaves to this computer where we're pointing, clicking, and typing for hours, to finally come back to being able to see that patient face to face and not have to worry about taking all those notes and actually have better notes at the end of it. It is really a huge benefit. Of course, there's some people that are concerned about new tech that comes along. I think now, Jaron and I both have been using scribes for a year or more, so it's not really new anymore. People can say, look, other doctors are using them successfully. It's benefiting everyone. And with this fully funded system, that removes all those barriers that you might think of. So yeah, I think this system that we're doing right now, with trying to get it into hands of clinicians, and reassure people that it's vetted, it's safe, it's going to work seamlessly, I think is a great thing.
Thank you for that. So what I'm hearing loud and clear is this isn't about dropping technology and hoping for the best. It's about building support around people and actually using it. So it's really interesting that there's so much value that can be demonstrated through our AI Scribe program and through other programs like it happening across the country. There are tons of scribes that are out there that we definitely recommend people to check out. And I'm glad to be part of a program and part of promoting a program like that to reduce administrative burden and support clinicians across the country. With that, let's jump into our question and answer period. We got a lot of questions and a lot of similar questions, so we tried to tie up and combine things where it made sense. Um, First one being, with new and ongoing AI Scribe and other innovative technology programs rolling out across Canada, what do you believe this signals to the market, and how might it influence how clinicians approach change management? Maybe we can start with you, Rashad.
Um, yeah, I think it's there's sort of two parts to that question. What does it signal to the market? I do think it signals that there is a definite interest in at multiple levels, the national, provincial, and territorial levels, and at the grassroots clinician level, in terms of adopting a new technology that is not just a technology for the sake of the technology, as you've talked about before, and I often repeat, it's really an entry point to seeing how a new technology and tool can have a greater benefit, not just for clinicians from the documentation and the burnout perspective, but from the sort of system level perspective in terms of standardizing data within electronic medical records, particularly community-based primary care electronic medical records, and how that standardization of information can also then benefit patient access to that information in a standardized format so that it's at their fingertips. It's also at the fingertips of those who are part of their care team. And so I think it signals a shift in terms of where we could go. And I think maybe it was Jaren or Lynn who alluded to this. There have been lots of technological changes over the past few years in health informatics and clinical informatics, but this is one that really seems to potentially have much greater potential to have benefits in multiple domains for multiple people over the next 5 to 7 years, probably even less than that.
Great. Jaren, Lynn, anything to add on? Okay, great. I know I'd like to take a second to address that there's been a lot of technical questions about the AI Scribe program. It's great to see that there's so much interest. And, although today we're not diving deeply into the specifics of the AI program, I do want to give you guys a couple of heads up about things. I know there's been a few questions asking about the different AI Scribe programs in the marketplace. There are AI Scribe programs being implemented in various regions across Canada, and clinicians are encouraged to review the criteria for each program available to them and consider their eligibility, preferred vendor, and clinical setting to determine which option best fits their needs. For those who are interested in learning more about our InfoWays AI Scribe program, please, I encourage you to visit our website and review our frequently asked questions. The link is in the chat, hopefully. And secondly, there have been a few questions asking about the pre-qualified vendors for InfoWay's AI Scribe program. Um, for our particular program, the roster of pre-qualified vendors were selected through a national request for a pre-qualification process. And this initial roster reflects a point-in-time selection of vendors who both chose to apply and who met all mandatory requirements, achieved the minimum evaluation threshold, and passed the solution demonstrations and successful contract negotiations. So if your current vendor isn't on the list, it doesn't mean that the solution is unsuitable. It just simply reflects that the vendor either didn't apply or was not part of the qualified roster for this particular process during this initial implementation phase of the program. So, like I mentioned before, for more information about our program, our roster of pre-qualified vendors, or even our FAQs, I encourage you to visit our website. The link, once again, is in the chat. So going back into the Q&A, panelists in line with some of the submitted questions and knowing there are many AI scribe solutions in the marketplace, what stands out to you as a non-negotiable from when you're introducing a new tool into your tech stack?
I
Jeremy?
can jump in on this one. I think a non-negotiable is trust, especially for something like this. And again, patient and physician, NP, et cetera. But I think for me, and so how I came to that level of trust is I review every note. So that typically takes me 30, 45 seconds. If it's a normal encounter, mental health, obviously much longer because it's much more detailed. But also the first 2 weeks, I still took notes, and then I would compare them to what the AI took, and that was a harsh reality check of, wow, I miss a lot. But then after that, just months and months and months of reviewing the notes and being like, yeah, that was what I said. That was what the patient said, and that was the plan. Initially, there were some hallucinations. The AI was coming up with interesting. It was diagnosing, and pretty specific. Zenker's diverticulum, and I was like, no, not quite. But the last 6 months, at least the tool I've used, haven't had any hallucinations. And so I think it's an experience thing. And you have to be aware that, this is ultimately you are passing your writing on to someone else. And so you want to make sure, just like you would with a resident, to review their work.
Yeah,
Great.
if I
Lynn?
could just add to that. Yeah, definitely I review every note, absolutely every note, before I copy paste it into the EMR, and you would be negligent not to read it. I mean, but Jaron's right. I mean, even over the last year, I've noticed an improvement in how the AI is working. There's very few hallucinations. There's very few inappropriate suggestions. We still get a few things where, there may be one speaker that says something and another speaker, and they get it slightly mixed up. But that's an easy one to fix. They're no longer suggesting inappropriate diagnoses for me. But it's such a pleasure to be just reading through it and going, yep, that's exactly what happened. And this is how it came out. And I agree with the point on the plan, and just copy it over and we're done. And I look forward to, the future of what they're now calling mature AI scribe solutions, where it will start to be able to generate consult notes for us and referrals and patient education and start to fill out those forms. I think it's in early days right now, but just having the ability to just have the notes taken care of has been huge.
Great. Thank you so much, Lynn. I know we're almost at time, so I just wanted to give an opportunity for each of the panelists to share any last comments that they want to provide to the group. Rashad?
Maybe I'll just echo what Lynn said so succinctly, that really this is the beginning. We're in sort of AI Scribe 1.0 across Canada, and that there's a lot of potential here with the right guardrails in place, at the national, provincial, territorial, Indigenous, with all those partners involved, to be able to carve a path forward that is safe, but also efficient and adds value for both clinicians and patients going into the future. And hopefully we'll add a little bit of extra sustainability and capacity in our system, but also add joy back to the practice of medicine and taking care of people.
Thanks, Rashad. Lynn, Jaren?
Well, I can echo that about the joy. This last year has been a real game changer for me. I don't dread the end of the day of that, huge amount of extra time that is spent doing really mindless administrative tasks. And yet it's important. So it has to be done. But to be able to just enjoy the patients again it's great.
And
I,
maybe
I
Jaren, just quick.
Oh, sorry. Yeah, I'd say, find a free trial. Doesn't matter which one. Just try it for a day, and compare it to the notes that you're writing and see what it works like. And if it works for you and you're like, oh, wow, this could be interesting, then you can spend time and get that, elbow at your coach to help you, and figure out workflow and all that jazz. But just try it out and see how it works. I mean, get patient permission verbally
Yeah.
first.
Thank you, Jaren, and thank you to our panelists and everybody who had an opportunity to join us today. We're going to be sharing materials afterwards with people, and we'll be back next month with more stories and innovations that are actually working across Canada's healthcare system. Thank you again, and until next time, take care.